The limbic system does present some fairly fascinating clinical correlations. One syndrome of note here is Wernicke-Korsakoff syndrome. This syndrome is characterized as a chronic memory disorder, and it is caused by a vitamin B1 or thiamine deficiency, and this is typically the result of chronic alcohol abuse. In Wernicke-Korsakoff syndrome, there's damage to the mammillary bodies, and the mammillary bodies are shown in through here. These are paired structures. And there's also damage to the dorsal medial thalamic nucleus. However, this is not shown in this particular image. Next, I want you to understand the symptoms that may result from lesions to the structures involved in Wernicke-Korsakoff syndrome. First is that the individual with this kind of lesion or syndrome, they will have difficulty learning new information. Secondly, they'll have an inability to remember recent events in their life. And because of this inability to remember recent events, they become prone to making up information that they do not remember, and this is also termed confabulate information, make it up. Another interesting clinical correlation that relates to the limbic system is Kluver-Bucy syndrome. This is a rare syndrome in humans, but when we understand the impact of lesions on the components of the limbic system, the symptomology that results does make sense. Kluver-Bucy syndrome is characterized by bilateral lesions of the amygdala and the hippocampus, and those structures are shaded here in the image. So here's your amygdala, and here's your hippocampus. Causes of Kluver-Bucy syndrome could be due to trauma or herpes encephalitis. What are some of the symptoms for you to understand that relate to an individual having this syndrome? One symptom is they'll have a visual disturbance. That would be visual agnosia. They also have oral tendencies. So they'll have a tendency to put objects in their mouth. Hypermetamorphosis is another symptom associated with Kluver-Bucy syndrome. Because of the emotional function that's attached to these components, these structures of the limbic system, individuals with this syndrome tend to have diminished or muted emotional responses to stimuli. And as a curiosity, they tend to display hypersexuality. Another clinical correlation to consider, and this is our last clinical correlation, is that of Alzheimer's disease. This is going to be due to severe atrophy of the hippocampus in this area, accumulations of senile plaques of alpha-beta amyloid would be seen histologically. And then we also see histologically an accumulation of neurofibrillary tangles of hyperphosphorylated tau proteins. As the disease progresses, it will involve more global brain structures to include the cerebral cortex. The occipital lobe is spared in cortical atrophy, and as you lose the cortex, individuals with Alzheimer's disease will display a widening of the sulci. Alzheimer's disease is the most common form of dementia. It typically has a late onset, so it does occur later in life. However, in some cases, it may have an early onset, so maybe the symptoms of Alzheimer's disease start to manifest in an individual who's in their 40s. And this tends to have an accelerated course, so it occurs more rapidly than a late onset form of Alzheimer's disease. What are some of the symptoms for you to understand regarding Alzheimer's disease? One is individuals that are affected will have memory impairment. This may start initially as forgetting where items are located. I misplaced my car keys, I misplaced my eyeglasses, and I'm having difficulty finding them. An individual may become disoriented and lost and are unable to navigate from home to work or work to home, or something as simple as a walk around the community in which they reside. If they get in a car, they may be traveling at great distance, not really knowing where they're at. They tend to have at some point difficulty with numbers. Another symptom associated with Alzheimer's disease that the individuals do not respond effectively or normally with their interactions. And lastly, individuals will demonstrate various behavioral changes that are most notable by family members.